Hello, everybody. Ramesh, MIT team. It's great to have a chance to connect with you all. At Deloitte, we've had this wonderful opportunity of being able to lean in to this national pandemic in a multitude of ways. We have literally thousands of professionals supporting efforts that range from contact tracing, testing. Figuring out vaccine and vaccinations, hesitancy, understanding public health communications and the like. And so it's great just to be able to absorb all of the material that I'm hearing today. There are a number of topics that I want to get into. The first is user design, and I'm really happy that we've heard from IDEO today. The importance of being able to go where our users are is important in overcoming a ton of the barriers that we see in place. And I'll give you a couple examples. A number of individuals who we work with and organizations have come to us and have said, hey, you've helped us establish a testing competency. How about if those pop up or other competencies we've established, how about we add vaccination to it? And there are a couple things that you learn and the reasons why those topics are really important. The first is that communities themselves need to feel empowered. Some of them may or may not want to be able to travel large distances on public transportation to reach a mass vaccination center. Some will be more than delighted to, but understanding the psychology of the community and the user experience of what they expect is crucial. Some perhaps may prefer analog, like we saw from Chris today. Some may prefer a digital experience. Understanding that psychology is going to be really important for us to overcome the hesitancies here as well. I'd also be remiss if I didn't talk about misinformation channels that have exploded regarding vaccination. And this week alone, and last week, I've been involved in numerous discussions with healthcare and public health leaders who've been trying to tackle this particular topic. And at the end of the day, there are misinformation channels themselves that need to be inoculated. They're very proximal to people. They're close. People use information every day, and expecting us to completely redo all of our information channels and all of our influence and the channels that we rely on may not be possible to do in the time frame that we need to vaccinate the populations here in the U.S. and abroad. So it's really important that we meet our users, like I said, to where they are, provide options for communities vis-a-vis pop-up capacity in terms of vaccination and the sort of technologies that we've seen today. I'll make one last comment. In the US, there's a fairly broad adoption of smartphone technologies that allow for text to QR code or web-based smartphone technologies, et cetera, during the scheduling process and so forth. But we do have to realize that there are populations, even in the US, that need help. And so the analog, the physical card is an interesting idea, but when we get international, that usage scenario is different. And I think we need to think about COVID as an international phenomenon, or COVID-19 as an international phenomenon. Just as in the US, we are thinking rapidly about escape variants that emerge from South Africa, the UK, and obviously, as of today, some people are talking about Brazil. We know it's a global phenomenon, and so it's important for us to think about how do you reach everyone. And there are going to be places that persistent network-oriented capabilities may be challenging. And so providing the alternatives that I think we've seen here today, obviously those that we've been honored to be a part of at Deloitte as well. Many of you guys who are listening to this know about the initiatives that we've already been a part of. But I think the discussion today is really important because, like I said, if we don't reach and meet the end users to where they're at, we're going to accentuate hesitancy, not resolve it. So, of course, I've got a fairly broad series of topics that I can get into. But I wanted to start off with those introductory comments.
Thank you, Asif. And those are some really important comments about vulnerable population, especially as we start thinking about global concept. So it's just a fascinating area. I mean, given Deloitte thinks about the full life cycle of many kind of health and health IT solutions, do you think this particular aspect of vaccine rollout will allow us to learn about what we do in the future?
I think we'll certainly not only learn from it, but it's interesting. If you look at our healthcare system, I'll wax philosophically just for a second. You see the emergence of the employer-based health plan benefit as a common practice emerged post World War II. So crises create demands in terms of employee retention, and employees start expecting different experiences. For us to get employees comfortable with full return to work, there's going to have to be the expectation that they're in a healthy environment, and the idea that there'll be this sudden shift between working perfectly from home and returning perfectly 100% in society, I think is a silly idea. It's an unrealistic idea. If we had a 1 month transition in terms of an experience, that would be one thing, but something that goes on for a couple of years, it tends to sit and reside in social consciousness in a way that creates permanent change. And so as a result, we'll have to learn from it, because residents and citizens and employees and students and professionals and staff and leaders, everybody will expect it. They will just simply refuse to have to go through environments where they feel like they're bearing disproportionate risk. And so we have to learn from it, because like I said, people will expect it. The other thing is that the social consciousness of public health is pervasive at this point. We see it with the current plans from in the administration today, but even prior to that, the notion that return to work and return to society is tightly interwoven and interlinked with return to health from a public health perspective. So this is not a once and done phenomenon. It would be a catastrophic mistake to expect that to be the case. We're going to go take care of some emergent things and then it'll just go away. I think people will expect more from us than they already are. And that's as nonpartisan a comment as I can make. And certainly my comments about the current administration or past, these aren't partisan comments. These are expectations of consumers and citizens and residents. And so all of the things that we've been talking about, do you have something that travels with you that allows you to get access to your health in a quicker way? I think we're going to see that to be a part and parcel of our experience. And if you look at any of the operating systems on any of our, whether it's smartphones or IoT, it's all the expectation in the base software. Slight changes in terms of how people deploy them, but it now has become an expectation of life and an expectation of the daily technologies we use.